Since the outbreak of COVID-19, the virus has spread rapidly, and there are currently approaching 111 million cases and over 2 million deaths reported worldwide. During the pandemic, adolescents have played a major role in the spread and mitigation of the virus. While younger generations are proven to have much lower mortality rates in comparison to, let's say, middle-aged or older populations, they are equally prone to contracting the disease and transmitting it to others. Therefore, I was intrigued to study the behavior and mental health of adolescents during COVID-19 because their developmental stage makes them more prone to acting on impulse rather than sound reasoning. Emerging studies have reported on several protective and risk factors which have affected adolescent behavioral responses and mental health during COVID-19. To simply explain some terminology, a protective factor refers to something that helps to prevent problems, while a risk factor is something that helps to create them. In my research, I have examined the role of household adherence to CDC guidelines and community satisfaction as protective factors, and the role of COVID-19 risk perception as a risk factor on individual adherence to CDC guidelines and depression. Data collection is still in progress, but the preliminary data suggests that risk perception and household adherence to CDC guidelines is positively correlated with individual adherence to CDC guidelines, while community satisfaction is actually negatively correlated with individual adherence to CDC guidelines. The results I just mentioned were based off of trends that I was able to observe through graphical representations of my data, just because statistical tests would not be significant yet. Once I have a greater sample size, Pearson correlation coefficients will be calculated. That being said, a weakness of this study is the limited number of participants I've been able to collect from thus far, which was also delayed due to COVID-19. The data sample is also not fully representative of adolescents nationwide because I've only been able to administer surveys within my school. However, a strength of my study is that I was able to utilize some statistically significant survey scales that have been established since I first started brainstorming my project last year. Through this independent research process, I've been able to receive guidance from my high school research mentor, Mr. Harshman, and he has reviewed my work and supported me in staying on track. Additionally, I've also received guidance from Dr. Erica Forbes from the University of Pittsburgh, and she supported me in refining my survey, and also she's guided me on how to best organize, analyze, and depict my data. Speaking of data that I've collected so far, one interesting outcome that I was surprised by was the community satisfaction appeared to be negatively correlated with individual adherence to CDC guidelines. So basically what this means is that participants who indicated increased satisfaction within their communities since the onset of COVID-19, they appear to abide by CDC health guidelines less so than those with decreased or no change in community satisfaction. So when evaluating this, my theory is that those who indicated increased community satisfaction are able to stay actively engaged in their communities in person, but that may tend to minimize their risk perception, and therefore they might not adhere to precautionary health measures like mask wearing or social distancing. After data collection is complete, I'm interested to see whether there's a correlation between risk perception and depression. In simpler terms, are adolescents who perceive COVID-19 to be a higher threat at a greater risk for depression? I believe it's extremely important to investigate the factors that affect adolescent responses to COVID-19 because it can provide insight into how society might handle this situation in order to effectively support adolescents in making smart, educated decisions when it comes to reducing the spread of this deadly virus. Also, my data illuminates how important accessible mental health resources are to help those struggling with depression, especially during this isolating time. Throughout this research project, I have gained insight into how we might be able to shift the tide of the current pandemic, which has affected us all, and simultaneously prepare for future health crises.